Hello friends, welcome to my channel. Today we will be speaking about Dorsalis Pedis Artery. Let us begin. Dorsalis Pedis Artery. Dorsal artery of the foot, chief palpable artery of the dorsum of foot. So, as we can see in this diagram, it is there on the dorsal side of the foot. Begins anterior tibial artery. So, Dorsalis Pedis Artery, as we can see in this diagram highlighted in blue, it is a continuation of anterior tibial artery and it is covered superiorly by inferior extensor. Hello friends and welcome to my channel. So today we will be talking about Dorsalis Pedis Artery. Now we'll start the video. Dorsalis Pedis Artery. It is a dorsal artery of the foot, chief palpable artery of the dorsum of foot. So, as we can see in this diagram, it is there on the dorsum of the foot. And this area highlighted in blue signifies Dorsalis Pedis Artery. It is palpated in vaso-occlusive disease of lower limb. We will talk about it in the clinical part. Begins from the anterior tibial artery. So, as we can see in this 3D model, this is the anterior tibial artery and then it continues as the Dorsalis Pedis Artery. This area, this is the full Dorsalis Pedis Artery and this is the anterior tibial artery. And it ends as a plantar arterial arch. In order to show the plantar arterial arch, we need to dissect some few parts. So this, as we can see over here, this is the plantar arterial arch. Now we will talk about beginning, course and termination. Begins in front of the ankle between the two malleoli. So these both structures are considered to be the malleoli and begins in front of the two malleoli. So this anterior tibial artery, then the Dorsalis Pedis Artery, and begins where? In front of the two malleoli. Goes to the medial side. Remember one thing, the thumb is considered to be on the medial side. So this is a medial side and then it goes on the medial side. I have oriented this diagram in such a way that you can also relate it and imagine it on your own self. So the Dorsalis Pedis Artery goes to the medial side. As we can see, it is going to the medial side towards the thumb, medial side, and goes in the first intermetatarsal space. So this is our first intermetatarsal space. Dips between two heads of first dorsal interosseous muscle. This is our interosseous muscle and this are its two heads. So it dips in it and then ends in sole by completing plantar arterial arch. So plantar arterial arch, as I said, it is over here deep to the structures. Okay, so once again, continuation of anterior tibial artery where the two malleoli are there and then goes to the medial side and then goes in the first interosseous space, dips between the head of the first interosseous muscle and then completes the deep plantar arterial arch. Now we will talk about the relations. Superficially, as you know that the foot is covered superficially by skin and also inferior extensor retinaculum which exists in this area. Let me show it to you. So this is our inferior extensor retinaculum. So what we have superficially is the skin, inferior extensor retinaculum and extensor hallucis brevis. So this is a dorsalis pedis artery, skin, superficial fascia and inferior extensor retinaculum and extensor hallucis brevis. This is extensor hallucis brevis which crosses the artery from lateral to medial side. Lateral to medial. The tendon over here is of extensor hallucis longus and this is extensor hallucis brevis which we are talking about in the superficial relation. And deep structures. We have the capsular ligament of the ankle joint and the bones talus, navicular and intermediate uniform which form the ankle joint. Now we will talk about the structures in medial which are the extensor hallucis longus. So this long tendon, as we can see, this is the tendon of the extensor hallucis longus which is there medially. And laterally we have first tendon of extensor digitorum longus and deep peroneal nerve. Deep peroneal nerve we can see laterally over here. And first tendon of extensor digitorum longus can be seen over here, laterally. So I have changed the diagram to a Vishram Singh diagram. So as we can see, this is the Dorsalis Pedis Artery. And now we will talk about its branches, which are the lateral tarsal artery, medial tarsal artery, arcuate artery and first dorsal metatarsal artery. So it's very simple to remember them. Lateral, medial, arcuate and first dorsal metatarsal artery. So now we will talk about the lateral tarsal artery. So as I said, the thumb is there medially. So we have the lateral tarsal artery over here. Just below it, the arcuate artery, metatarsal artery, just opposite the lateral one. And we also have the first dorsal metatarsal artery, which is dipping in this first dorsal introitious muscle. And now we will talk about it in detail. So the lateral tarsal artery, this one, it is larger than the medial one and it arises over the navicular bone, which is somewhere over here, and ends in lateral malleolar network. And then we have the medial tarsal artery, which are 2 to 3 small twigs and which joins the medial malleolar network. Then we have the arcuate artery, which I said, which is just below the lateral one and it is opposite the medial cuneiform bone. And it ends into lateral tarsal and lateral plantar branches. And then it also gives second, third and fourth dorsal metatarsal arteries, which are these. These second, third and fourth dorsal metatarsal artery divides into further perforating arteries, and then we have the dorsal digital arteries which arises from it. Okay, so the first dorsal metatarsal artery, it is a direct branch of the Dorsalis Pedis Artery, whereas the second, third and fourth dorsal metatarsal arteries are branches of the arcuate artery. That's a very important point to be remembered here. And we also have the first dorsal metatarsal artery. As we said, it is just a continuation of Dorsalis Pedis Artery, and it is given before it dips into the sole. Its branches supply the medial side of the big toe and dorsal distal branches which give adjacent sides to first and second toes. So this is its branch which supplies the toe and also supplies the first and second toe. So now we will talk about the clinical part. It is important that Dorsalis Pedis Artery pulse. It can be easily felt between the tendons of extensor hallucis longus and first tendon of extensor digitorum longus. As we have already discussed in the 3D relations. And it is palpated in patients suffering from vaso-occlusive diseases of the lower limb, which is the Buerger's disease. And the clinicians testing this pulse should know that the Dorsalis Pedis Artery is congenitally absent in about 14% of the cases. In such cases, if the Dorsalis Pedis Artery is absent, we should confirm the pulse by posterior tibial artery. Thank you. Do like, share and subscribe.